Mana?
Moderate amount of intensity of stress.
Second sound.
So this is why work with our body. If there is no stress, I don't think there is no this is what I would like to
Second sound.
social distancing or hand hygiene or respiratory etiquette. You don't follow any of this, so you are putting yourself and people around you, be it your family, friends, and neighbors, at risk of contracting the viral infection. However, if you are too stressed, what do? That also results in certain problems, which leads to a bad functioning of yourself, be it physical or mental. What are those deleterious effects? I'll be talking in a couple of minutes, next couple of minutes. Now, whenever we talk about stress, there is a stressor. Usually, we have stress and we have a stressor. For example, let's just say that I'm sitting here in this room and suddenly I hear a fire alarm goes on. Immediately I hear it and the signals are sent to my brain and my brain will release these stress hormones, obviously sensing me to detect that something is going wrong. Maybe the hospital is, it's going into like, there's a fire put on somewhere. So immediately my heartbeat will raise. I'll start feeling breathless and I'll start getting panicky. And the safest thing to do is either to fight the threat or run away from the threat. Being a smart person, I'd probably run away from the threat and not fight it. That's how stress is important for our body to react back to it in a way that helps us survive. It's basically survival mode. However, I'm sitting here, there is no fire alarm, but I'm sitting here thinking, a lot of thoughts, mostly negative thoughts, where I'm sitting and thinking, oh, what if the hospital is set on fire? Or what if there's a snake that comes into my room? What if I have a heart attack right now? Or what if I lose my job right now because I'm not doing well? These thoughts also generate same response as the real stimulus. For example, this thought itself can secrete a lot of stress hormones, which does affect my heart rate, my respiratory rhythm, and might give me a panic attack, which might put me in a cardiac unit. So this is called as stress. There is good stress and there is bad stress. Good stress is called as eustress, EU. Eustress. Eustress is actually a good thing. For example, you have a promotion. You're going to become MD of managing director of your company, or you're going to become a team leader of the IT company that you're working for. You're getting married. You're going to have a baby, probably for the first time. Um, all these are positive, or you're buying a house. All these can be a positive stresses. Distress or negative stress is what affects us in a deleterious or in a bad way. Going back to our next part of the topic, that is, how does stress affect our body? Stress affects body, brain, your physical health, mental health, and emotional health. The symptoms are also as such of the stress, because a lot of times when patients come to my room, 70% of them come and tell me, especially in the last 9 months, that when I ask them what brings you here, they usually tell me I'm feeling stressed. When I ask them, okay, you're feeling stressed, now what are the symptoms? What are you exactly going through? They usually fail to answer because, a lot of people don't see it as a disease and they don't see what are the symptoms of it. When I start asking them, are you feeling this or are you feeling that? Usually they say yes or a no. Mostly yes, then a no. So let us understand what are the symptoms when you are stressed. What can happen to your body? What are the after effects of stress? First thing is, let's just go with your um, the most common thing, 39% common, fourfold increase in the last 9 months because of pandemic is anxiety. Anxiety is the first manifestation of stress. Then I'll talk about physical effects later. First, I'll talk about psychiatric effects. Anxiety is the first thing. How do you recognize anxiety? How do you recognize that you're stressed? It has physical symptoms and psychological symptoms. Physical symptoms are called as palpitations. Now, palpitation is nothing but a racing heartbeat. Normally, I'm here talking to you right now. I don't hear my own heartbeat unless I place a step or someone else places a step on my chest. When I'm stressed, my heartbeat raises to a bigger level that makes me hear to it without even a stethoscope. Even when you're watching a movie, when it's a stressful situation, usually the background music itself changes into a heartbeat, a loud thumping heartbeat. That is one of the symptoms called as palpitation. Second symptom is called as chest tightness. I'm feeling like my chest is very tight. It's constricting. I'm not able to sit relaxed. I'm not able to breathe well. This is the second symptom. Third symptom is shortness of breath. I'm not able to breathe well in spite of being in a well ventilated area. I'm feeling like I'm gasping for air or I'm choking. It's cry for help. That can happen, shortness of breath. You can have dryness of mouth. You can have blurred vision. You can have urinary urgency. You can feel nauseous or you feel like you're going to throw up. You might actually even vomit. You can have giddiness or lightheadedness, where a lot of people even faint because of like stressful situation. If someone has heard that someone passed away or someone is in a road traffic accident and admitted in a hospital or getting operated, you see some people faint. That can occur too because of excess surge of stress hormones. You can have multiple unexplained pains. You can have neck pain. You can have back pain. You can have constant recurrent headaches. Usually what happens is a lot of people come to neurology department for headaches. Usually, neurologist tries to differentiate diagnose between if it's because of stress or it's because of some problem within the brain. Um, Usually, stress-induced headache is very very common. That's when they refer to me as well. So this can occur. Yeah. So these are the physical symptoms of. One more important symptom is muscle tension, where you're always feeling like your body is very stiff or contracted. Your muscles are not relaxed at all. All this can happen in physical situation of stress. Now, what are the psychological symptoms of stress? The first important thing is restlessness. Here I am sitting very relaxed. I'm leaning myself to the back of the chair and I'm talking relaxed. If I'm stressed, my posture would be something like this. I'll be on the edge of the seat. I won't be able to relax well. So that feeling on the edge, that can occur. Feeling of doom, we call it. We finally say to people, like I'm going to get doomed because of some stressor, it's a feeling of doom or loss of control. People feel like something is about to happen. They might have a heart attack or they might faint right now, they might collapse, the world might come to an end. These kind of thoughts, a lot of negative thoughts also occur in case of stress. So if you are experiencing any of these symptoms, it's safe to definitely see a doctor first. And also follow the relaxation techniques that I'm going to teach you towards the end of the session. So these are the symptoms of the first symptom of the stress is anxiety, and this is how we present. Second symptom of anxiety is of stress is definitely depression, where you're constantly having low mood, no energy, feeling lethargic, not able to concentrate on any work, no interest in doing anything, no motivation or drive or will to do anything, or start an activity or a mental task. You can't. Like this is when your grades will fall in the school or you probably won't get a good report at your workplace or your work performance is dropping. This can occur. You can have sleep disturbances that also can occur because of stress. Either you could be sleeping very less or sleeping too much. That can occur for sure. There can be problems with the appetite. You could be eating less or overeating. Where a lot of the patients that we are getting right now are overeating or comfort eating because um, lockdown, they're stuck at home, they're not doing much activity. So easiest thing is to just click away and order probably something over Swiggy or Zomato, which is just a click away. So most of us tend to cope with eating food. So that is in turn going to lead to obesity and things like that. So that is also happening. Also, another problem with the stress is substances. A lot of us, we tend to cope with stress using substances, for example, alcohol or smoking. Whenever I see a lot of my friends also, when they're stressed, the first thing they do is they go to see a doctor. Instead of going to a doctor, what they do is they immediately go to the balcony or someplace and they start smoking because smoking does give the temporary sense of relief. It relaxes your muscles. So they think that smoking is healthy. I don't need to go and see a doctor. I don't need to take medicines. Why should I do it? So that itself causes addictions. So increasing substances also is what we're definitely seeing in this pandemic, in the times of crisis. Not just pandemic, it could be some problem at your own home. You can apply the same theory, same hypothesis, and the same coping strategy I'm going to tell you right now. So all this can occur. These are the psychological or emotional problems that can occur because of in the time of crisis, stress causes. What are the physical diseases that stress can exacerbate? Literally anything and everything. Back in the medical school, when I was doing my MBBS and MD, I used to read at every disease. The one of the main risk factors is stress. And I used to wonder how can stress cause these many diseases? It's not possible that like one simple thing called stress causes heart attacks and hypertension and whatnot, strokes, etc. How does it cause it? And as I got specialized and I got trained in it, I understood that how it causes. So it's not as simple, when I thought stress was a simple thing, it's not a simple thing. Um, so the physical problems would be hypertension can occur. Hypertension, nothing but increased blood pressure that you might put on treatment for. It can change the sugar fluctuation because I already mentioned cortisol is a stress hormone. Cortisol also regulates your blood sugar levels. So you can easily become diabetic here. Or if you're already a diabetic, the diabetic control will be as good as before the pre-stress state. You can have cardiac problems. Usually panic attacks that occurs in anxiety also resemble cardiac attacks. That's a lot of patients when they're extremely anxious. They're brought to our ICU, sorry, not ICU, emergency room, and then ECG is done, echo is done, and then we rule out if the cardiac person is going into cardiac failure or not, and then then obviously they refer to me, and then I see why is it occurring, why is this panic attack occurring, either physical causes, psychological causes, and so on and so forth. So cardiac problems and cardiac arrest can occur in somebody who is constantly stressed, chronically stressed also. Um, it can also cause a lot of other physical symptoms like graying of hair, a lot of us see we all having white hair, someone who is as young as 25 and have white. So premature graying can occur, sexual dysfunction can occur, so it can reduce the sperm count, your libido, and your fertility rate. So it can make you impotent. That can occur as well. Even for women, they can have a lot of gynecological problems because of stress. Women who is stressed can have spontaneous abortions also, instead of taking healthy diet and following doctor's advice, your gynecologist's advice. Uh, you can still have to threaten spontaneous abortion because of stress. In a non-pregnant woman, because menstrual irregularities, it can cause thyroid dysfunction. So stress is basically implicated in more or less all the diseases in the science of medicine. Um, now that it's scaling enough, I want to talk about what are the different coping strategies, healthy coping strategies, because I know a lot of you cope consciously, subconsciously using some strategy or other. Some of you might cope with smoking, some might be eating, some might be talking to a friend, some might be watching movies. There are different ways of how people cope. But what are the most healthy ways to cope, especially in a time of crisis like this, is the first most important thing is your sleep. Sleep is extremely important because sleep is the time when your brain gets to rest, scan your body, understand your body, and produce some chemicals that are required to function of your body the next day, or stop producing some chemicals that are probably affecting your body in a negative way. Sleep is the time. When you're not giving your brain enough rest, your body tends to shut down. Let's just say that we have an air conditioner here and I'm running it constantly for days together without even turning it off once. It will give away. The motor will run away. That can it can get spoiled. Same way, brain is an organ that requires rest, and rest occurs mostly in the sleep. When a person is not sleeping enough, it can cause various kinds of diseases. Probably the same disease that I mentioned before. So sleep is very important. Now, how do you? Some of them are thinking, we know this, but how do we sleep well? We are not able to sleep well. There are simple sleep hygiene techniques that you can do to probably sleep well. One of the first things is to maintain a sleep-wake schedule. You know, most of us sleep late. Me being a doctor, I don't really sleep that early. I sleep around 11, 12, which is late. But at least make sure you're maintaining the timing. Every day, if you're sleeping at 11, the best is obviously sleeping early and waking up early. I'm not advocating anything but that. But if you are not able to do that, at least if you're sleeping by 11 o'clock, make sure you're hitting your bed every night at 11 o'clock. So don't confuse your brain in an erratic way about, oh, when do I sleep? When do you wake up? Because brain can't sleep. If you're keeping on waking up in the middle of the night or sleeping very late, brain will not get enough rest. Second important technique is to not to nap throughout the day. Some of us tend to nap. We love our afternoon naps. Our parents, grandparents, or even probably you IT guys who are working from home. Because you have the privilege of napping. Maybe you're working from home and you're taking naps for like good 2 hours in the afternoon and working after that. Please don't do that. You're not supposed to nap. The concept of power nap is something that is not really like medical, but I'll tell you what is the healthy way of napping. Avoid napping because when you tend to sleep in the afternoon, your brain tends to think that it is night and brain will start shutting down all the resources and suddenly you wake up 1 hour later to an alarm or spontaneously. Your brain will have difficult time to switch back all its resources, all the areas, and to start producing whatever it's supposed to produce. That's why if you observe a lot of you, when you wake up afternoon, you don't feel as active. You feel very gloomy, lethargic. You don't want to do anything. You just like lie down, just pass off the rest of the time as well. That is not healthy at all. But however, if you're extremely tired, it's okay to nap once in a while for not more than 15 to 20 minutes, not more than that, in the early afternoon because sleep has different stages and different cycles. If you sleep and wake up in the first stage itself, it's not going to affect your nights. The afternoon nap will not affect. But if you've crossed the second stage and gone into like third stage or fourth stage, then if you wake up, night sleep will get affected. So the first stage of the sleep will occur for only 15 20 minutes. So you can take a power nap in that time and quickly get up without letting your brain know that you have napped. So that's definitely a healthy way for you to do that. However, avoid napping. People who nap are the ones who come with sleep disturbances much early in their life. They are the ones who need sleeping pills and different medications that aid for sleep. Third important thing is about how when do you eat food before going to sleep. You should eat at least 3 to 4 hours before you go to bed because the food that you eat will take at least 30 to 45 minutes to get, sorry, 3 to 4 hours for it to get digested, absorbed into your blood, cross the blood-brain barrier and reach your brain. It takes about that much time. If your brain is not nourished well, how will it rest well? It can't. So it will tend to like probably throw some nightmares, some dreams, bad dreams, and it might keep you up in the middle of the night. This is when you'll have intermittent awakening, and then you'll feel hungry, and then you like munch on something else, etc. Another ways to sleep well is, which is very very difficult, but it's a big culprit. We all have to get about it. Our screen time. Our screen time is very important because the blue light that gets emitted from the screen. You see the light. You see this light that is falling on me. This blue light that is emitted from the screens. It impairs secretion of a hormone called melatonin in your brain. This melatonin is required for you to initiate sleep and to maintain sleep. Because of this light, the hormone is not produced, so it won't be able to maintain the sleep wake schedule well. So at least 1 to 2 hours before you go to bed, avoid using screen. Instead, what you can do is probably you can read a book, or you can do something else. You can sketch, or you can paint. Do something else that will even reduce your stress. That's one way to do sleep well. Another great way to sleep well is not to smoke, especially after 6 p.m. But I'm not advocating you to smoke before 6 p.m. That's not what I said. Don't misunderstand what I'm saying. But especially after 6 o'clock, smoking can affect your sleep. Also, intake of certain stimulants such as caffeine or any carbonated soda, Amstel, Coca-Cola, whatever, any of these will have some amount of caffeine, which will keep you up, and it will be difficult for you to put your brain and body back to sleep. So that is also one of the important things that you can avoid, and avoid lounging on your bed. Use bed only for sleep or sex. Don't try to just roll and turn and toss on the bed. Don't do that. One more important thing is please do not watch 9 p.m. news because right before you go to bed or right after you wake up from the bed, do not reach for your phones and look at the news, or do not look at the news on the TV as well. The ideal news time for you to not be stressed, not be overwhelmed is somewhere in the early evenings around 4 o'clock, but have a designated timing for news as well for 30 minutes or 20 minutes, how much ever you need to. Even though unnecessary WhatsApp forwards, a lot of baseless rumors about vaccination and lockdown and various other things, do not look at them. You be safe for yourself and for the community. Don't trust any rumors that are going on. That is about sleep. What kind of food you can take to sleep well is definitely you can try chamomile tea. Chamomile tea is something that probably soothes your brain, relaxes your muscles, can help you sleep. Intake of curd, which is a probiotic, also helps you sleep well, or a glass of warm milk helps you sleep well, or just like a warm oil massage also, head massage also can make you sleep well. This is what you can do. This is the first thing in terms of stress management. Second thing in terms of stress management is definitely your daily rhythm. Daily rhythm is the most important thing, especially when the world has lockdown and the times of crisis like this, because I mean, for us doctors, nothing much changed. We're coming on the same time, going on the after the same time. But for people who work from home, the daily rhythm has changed, and that has caused a lot of effects on their brain and body. Because for years, your brain is used to working in a certain way, in a certain time. If you're changing that, it's difficult for your brain and body to get adapted to it. So here, what you can do is try to keep your routine or daily rhythm as close to pre-pandemic phase. For example, if you were working from 9 o'clock to 4 o'clock, right now, instead of you working from home, please keep it as close to 9 a.m. And get out of the work as close to 4 p.m. Don't try to change it much. Um, Also, have a designated workspace in your house, extremely important. You don't need to have a big house for that. You can have a small house, a room, a corner of the room, preferably next to a window because you also get vitamin D through sunrays also help you secrete vitamin D in your body, and vitamin D is required for you to focus your attention and not feel lethargic or be very active in the morning. That is something that you can do. Have a workstation with maybe a plant or two, or get some nice sunlight and some air, and try to work as close to your work style as in your office it was. Try to take breaks in between. When I say breaks, digital breaks. I don't want you to go from your computer to your mobile. Instead, go from computer to probably take a flight of stairs, go help somebody in the kitchen, or just go play with your kid, or talk to your parent or spouse, something. Something like that is what you can do. That will definitely help. Also, your eyes need a lot of rest. Stress also causes a lot of eye problems. That's a lot of people have weakening of the eyes prematurely, etc. That is something that you can do. Maintain the social rhythm or daily rhythm, not social rhythm. Sorry. Also, dress up for your work. Instead of you working in your house, you can, even if you go to the next room, put on your work clothes, because there's a research that says that how your work clothes feel on your body, the texture of the clothes, the length of the clothes, whatever it is, the parameters of the clothing will decide that sensation of the clothes will decide how your brain works at its best capacity for you to probably like do well into work, because we all need our best part of the brain kicking up, right? Like logical thinking, abstract thinking, judgment, insight, etc. Problem solving capacity, etc. is what we need on a daily basis. Be it a doctor, engineer, or architect, or whatever job you're doing. So, for example, let's just say I'm doing this meeting from my home. I'm in my shorts and t-shirt. I won't be able to talk this productively, maybe, because my brain will give me signals that it's your lounge where you're going. It's supposed to lounge. It's supposed to relax. So maybe I won't be able to think on my best foot forward. I won't be able to put it best foot forward. So you dressing up is also very, very important, even if you're working from the home. This is another way to probably focus better and not feel stressed. Another way to reduce your stress is to understand your capabilities and your shortcomings. What happens is a lot of time we are not assertive and we tend to take up every work that is given to us, especially IT, because most of the patients are IT employees. Sorry, that's why I'm giving their examples. For example, if they're taking a project that definitely is clearly overwhelming or above their capacity to do it, assess it properly. Don't take every work given to you, because when you have too many deadlines and too many targets, that is when your body will go into a hyper alert state called stress, and you will be able to tolerate, and you will start crumbling from there. So be assertive and take what is required to you, and yeah, that is important. What are the different ways to reduce stress? Lot of stress also depends on what kind of food we eat. Are we eating simple carbohydrates? Are we eating complex carbohydrates? Are we eating a lot of fats? Are we eating a lot of protein? Are we even having vitamins and mineral nourished food? All this is important, because every patient that I'm coming to my room, when I test them for B12 or vitamin D, most of them are deficient. Some are insufficient, some are deficient. So we have to give them store-bought vitamins. So instead of buying store-bought vitamins and taking multivitamins, why don't you eat well? Cook a balanced meal. Google is just a click away. This is when you can use Google. It's okay. Not for the medications and for the diagnosis of your diseases, but the nutrition, etc. Locally available. I think Indian food is one of the best food, anti-stress food. Even West is doing a lot of research about how to produce locally in USA and other countries Indian food, because our life expectancy is better in spite of population. Um, Not so advanced. Whatever. Because of all this, you have to eat well. Maybe you can start cooking at your home. That is a great way for you to bond with your family, and also for you to probably eat well. And another way to combat stress is through by combating dehydration. Your brain's fuel is largely water, sugar, and oxygen. Whenever these three become less in your brain will tend to throw a tantrum for stress, right? So, and in India, I'm sorry, in India, all of us drink water only after we eat food, that is 3 times a day or 4 times a day. So we all eat 3 meals or 4 meals a day. So that's 4 glasses. That's not enough. That's barely a liter. You're supposed to drink at least 3 to 4 liters, or maybe I drink 6 liters of water per day. It is that important. However, if you are a cardiac patient and if you're asked or you have a renal condition or a kidney problem, if your doctor has told you to restrict water, then it's okay. But otherwise, please take a lot of water. These are simple ways for you to combat stress. Now, there are 3, 4 techniques that you can do to combat stress. First thing is to get a hobby. Hobby, when I have hobby is not watching movies and talking to friends. Hobbies are little more than that. Hobby is probably art, photography, or I don't know, doodling, or writing, journaling, poetry, dancing. Find a different way to relieve your stress, because sometimes it's not about talking. You don't need to always talk about your stress. You can even express your stress in a creative way. For example, when I'm stressed, I tend to paint, and when I'm painting a lot, that means I'm stressed a lot. When I'm not painting much, that means I'm fine in my life. So you have to, pick a hobby that is most creative. That output is not important. Just the process of you channeling your stress through this hobbies is definitely important. That will help you de-stress and relax. Another fantastic way is for you to exercise. I mean, I should have done this much earlier in the stress management. Exercise secretes hormone called endorphins. Endorphins are happy hormones. They are the natural chemicals produced by your pituitary gland in the brain that will keep you alert, fit, active, stress-free. Exercise, when I ask people, they say that, we're doing a lot of housework, that is enough exercise. That is not enough exercise, that's just body strain. Doing the same repeated activities, no exercise. Instead, trick your brain, do cycling or do dancing or do yoga. Yoga and meditation works wonderful. There is medical research supporting this, where yoga and meditation helps one reduce their stress levels. So you can definitely do this. And the right time to do exercise is in the morning, not in the evening, not close to bedtime. There is a myth about exercising in the night, so your body feels tired and you go to sleep. That is a myth. That is not true. You're supposed to exercise to keep yourself active and alert, not to sleep. So try to exercise in the morning, especially when you wake up in the morning in the natural sunlight, probably in your balcony. Fantastic. You can exercise, endorphins are high, vitamin D secreted, stress hormones are getting reduced. So you're going to be good for the rest of the day. So you can do that as well. A few more techniques is deep breathing. Whenever I'm feeling stressed, one important way to trick your brain to reduce the secretion of stress hormones is deep breathing. Slow, deep inhalation for a count of 4. Hold the breath for the count of 4. Breathe out slowly for the count of 4. And then count till 4 and then start breathing in again. So this completes the square. A count of 4, slow breathing in. Holding the breath for the count of 4. Breathing out slowly for the count of 4. And again, waiting for the count of 4. Then you start breathing in. This is the square technique of breathing or box technique of breathing. This works wonderful because when you take a deep breath, the diaphragm, the muscle that separates between your chest and abdomen, that tends to expand and it sends signal to the brain saying that to reduce stress hormones. So immediately you'll start feeling better. So do that. Another fantastic way to distract your brain when you are stressed or when you're having too many anxious thoughts is um, reverse counting. You can take a large random number. For example, I'm stressed right now. I can take a random number called 48,200. I'm going to close my eyes, stretch myself, and 48,200, 48,199, 48,198, 48,197. When I'm doing this slow reverse counting, your brain can't multitask. So it tends to diffuse your anxiety as well. That is one way to do it. Another way to reduce your stress is called as grounding technique. Grounding techniques are bringing your awareness to right now at the moment rather than thinking about the past or worrying about the future. So grounding technique is where, let's just say I'm very stressed. I'm gonna sit here. It's a quiet room. I'm going to sit here and I'm going to focus on 5 different things that I can see. I can see a chair, I can see a sanitizer bottle, I can see a water bottle, I can see my phone, I can see a TV in front of me. So 5 things I'm going to see, I'm going to concentrate. I'm going to draw my awareness to these things. And basically, you activating your sensory system, that is your vision, your smell. Couple of things that you can smell, what you can smell right now. I can smell my cologne right now. I can smell that it's very musty in the room. So it can be good, bad, ugly, it doesn't matter. Any of preferably pleasant smells. A couple of things that you can feel. I can feel my shirt on my body. I can feel the watch, or I can feel the sanitizer bottle, or I can feel the cover. So basically, I am bringing all my awareness to these sensations or something that I can taste. So probably I can just have a dark chocolate, which also secretes your endorphin levels. I can do something like that. This is called as grounding technique. This definitely helps. So these are various ways for you to combat stress. I think before we end, one last technique for you to combat stress is definitely muscle relaxation. This is when I take an individual muscle, I'm going to contract it, I'm going to relax it. For example, this muscle, I'm contracting this muscle, I'm going to relax this muscle. Flex my eyes, I'm going to contract my eyes, I'm going to relax my eyes. I'm going to clench, I'm going to shrug, I'm going to contract my biceps, triceps. So I'm going to reduce my muscle tension caused by stress. That is a great way to reduce the symptoms of stress. So I think these are pretty much effective ways to combat stress. So you can try out what works for you. Before we end, I would like to take some questions that we got. quickly. Someone is asking me, stress is usually thought of as a negative experience, but it can be a positive one. True or false? Absolutely true. Stress can be positive as well. Moderate amount of stress is positive. Also, the type of stress, if it's a eustress, it is positive. Promotion, childbirth, marriage, etc. Someone asked me about, is it possible to eliminate stress? True or false? It's not possible to eliminate stress. Stress is going to be constant in your life. Accepting that will definitely give you some kind of solace. But your perspective towards the stress, or how you react, how your brain and body reacts to the stress, you can definitely control with the help of a doctor, or sometimes without also. Yeah, so it's not possible to eliminate stress, but our reaction to it is something that is possible, that we can change. Next question is, chronic stress is constant and persists over time. True or false? True. Chronic stress, the name, the word chronic itself means that it's constant stress for a long time. The hormone known as cortisol helps the body manage stress. True or false? Yes. Cortisol, catecholamines, etc. There are a couple of other hormones. All these hormones help in maintaining stress levels. Physical symptoms of stress that include, already mentioned before, palpitations, shortness of breath, lightheadedness, giddiness, vomiting, body pains, muscle tension, urinary urgency, blurred vision, headaches, many symptoms. What are endorphins? Endorphins are brain chemicals produced by pituitary gland in your brain. These are natural opioids uh, that are not obviously drugs of abuse. These are produced by your brain that keeps you very happy. Yeah. A stressed person can stimulate endorphin release by doing what? What are the different activities to stimulate endorphin release? Only three ways to release endorphins. Not only three ways, mainly three ways. First thing is exercise secretes endorphin levels. Second is by eating certain foods like dark chocolate or tasty food, also somewhat healthy, that also secretes endorphin levels. Sex also secretes endorphin levels. Massage, acupuncture, all these are under trial to know if they're produced or not, but they also can produce. Even music, good music, soothing music can produce endorphins apparently. But exercise, sex, and certain foods are definitely proven. Is stress inevitably harmful to health? It is absolutely harmful to health. A little bit of stress, a moderate amount of stress once in a while that keeps us on our best foot forward is normal. But someone who is constantly stressed, not getting a break from any stressor, they are definitely going to be affected by affected physically and mentally. Does stress cause hair loss or gray hair? Yeah, it does cause hair loss and gray hair. For sure, I already mentioned before. Premature graying of hair can occur in people who are stressed. Could be genetic as well. Don't think everybody with white hair in their early 20s, 30s are stressed. Most of the time, I feel nauseated before exams. What do I do? So when you're feeling nauseous before exam, that's definitely a symptom of stress. What you can do is probably go run to a washroom, find a quiet place, lock yourself, and take slow deep breaths, and tell yourself you're going to be okay. You're going to be okay. If a student does not score well, then it means the student is very weak and he is not intelligent. Is it so? Okay, it's not today's topic, but definitely I don't think so. Exams are the way to tell if somebody is intelligent or not. And weak is not a good word. So nobody is weak. Everybody has their own strengths and weaknesses. Everybody is strong and weak, depends on the situation they are in. So I don't believe in labels. And I don't think someone who doesn't do well in exams are not intelligent. Maybe it's just the day, maybe it's just poor preparation that has caused it. Understanding that and moving forward will be helpful. Yeah, I think I have a few more questions, but they're not relevant to today's topic. Yeah, we got one more question. Stress is an unnatural reaction, true or false? Stress is a natural reaction. It's not a unnatural reaction. Someone who never gets stressed is unnatural. So if you're never stressed, check yourself. Yes, I think that concludes our talk for today. I hope it served help. But try to do all these techniques I told you and see what works for you. And if they're not working, please don't wait till your roof is blown up. Please come and see a doctor. It's absolutely important. We have to rule out if any physical condition or any hormonal imbalance is causing this stress in your body. Because stress can occur from the body, from the brain, from the environment also. So we can take care of that. I hope all of you are staying safe and taking care. Thank you. Can we conclude? Yeah, done. What is it?